so much for being here with me today for this amazing conversation titled Generational Shifts, a conversation on the changing perspectives of young doctors. So to get us started, I would love for you all to introduce yourselves. If you are a resident or student, share what year you're in and your specialty.
Thank you so much for having us. And my name is Dr. Heather Schickedanz, and I don't consider myself a young doctor anymore. I've been in practice for over 10 years. I'm the chair of the Department of Family Medicine at Harbor UCLA, and I'm an associate professor at the UCLA David Geffen School of Medicine. And I'm a very proud and humble family medicine geriatrician. I just wanted to state right up front that we all who are participating today are really sharing our perspectives as individuals and not necessarily speaking on behalf of the institution. So I think that's enough for me.
Hi, I'm Dr. George Truong. I'm also from Harbor UCLA Medical Center. I'm a second-year resident in family medicine.
I am Dr. Maria Gonzalez. I'm also a second-year family medicine resident at Harbor UCLA.
Perfect. And to get us started, it's the age-old question, which I'm sure you all have been asked a million times during your journey to becoming a physician. But what made you interested in becoming a doctor? It's a very rigorous path to go on, and it's a very important role, in the world, not just the community. But what really inspired that passion to pursue medicine?
I think initially I've always been very politically involved, and just I guess younger as when I was considering what career employment I would pursue. Medicine seemed that very much at kind of the forefront of a lot of things as one science, but also kind of the social, geographical. It was a combination of a lot of things where you see that manifest in the body and the way people live their lives. And I felt like it's a very good place to start if you want to affect any changes being within medicine. So I guess I mainly went in there to try to gain some understanding of how do we make ourselves and in a larger part of society more healthy.
I think the why medicine for me for a while has been my parents. Part of my personal experience is that I am an immigrant. I was born in Mexico. I immigrated with my mom and dad and my two sisters to Central Valley of California. And they had a ton of chronic conditions. And something just didn't feel right for me as I navigated the healthcare system with my parents. A very personal story is after my dad having a heart attack. He did not speak English, so I was his translator, having to take a bus from the small rural town that I lived in to the more urban area for 3 hours, making it to the cardiologist, and there just being a really long wait, and just having this sense of oh, there's probably not enough doctors. So I think that sort of was the beginning. So I started to feel okay, maybe I can be a doctor so that I could be a doctor to people like my parents. And I think consistently that's been one of the root reasons behind what has propelled me to continue this really crazy and rigorous training.
Yeah, I'll sort of take a little bit from both what Dr. Truong and Dr. Gonzalez shared. I think first and foremost, it was my family as well. That was my why. I actually grew up in Southern California. I was born in Long Beach. And my family story is quite different as each of ours is, but I was also very much involved in the care and the sort of healthcare navigation of my family members starting from when I was born. And so I think that experience coupled with growing up in Southern California and being raised with a lot of the values of inclusion and wanting to just lift others and use whatever privilege and whatever opportunities that I had to sort of help serve. I think that definitely compelled me. And as Dr. Truong said, and Dr. Gonzalez, just seeing how much injustice and inequity that there is, and recognizing that we all have a role to play in eliminating that.
I love that that is the common thread that unites all three of you all's stories, that brought you to this juncture in your careers. And so now that you're here, like you are physicians, you are practicing, whether it's residency or your full practice. But how do you bring those personalized experiences and those inspirations that you mentioned that brought you to the field? How does that now show up in your practice, in the ways that you help and provide for your patients?
I can answer to that. I think something that has been like very palpable, especially in these years of residential training, is that a lot more work needs to be done. Because at the inception of my Y medicine, I couldn't even formulate the language, but something didn't feel right about access and how difficult it was for my dad to see a doctor. But being a resident now, I still feel very similar, and feeling the need that I'm still working on finding the language and the avenue, but the understanding that there needs to be really large systemic changes, it's even more palpable now, because I see patients that are like my parents, full volume. And I wish that part of me reflects that by the time I had become a doctor, then maybe things would have been better. And they probably are in some ways, and in some ways they're not. So it keeps feeling me like a reminder that there is still a lot of work to be done.
Just kind of going off of that, as far as for me, I think we all, it seems like everyone, and it makes sense, everyone has their own stories of why we arrived to this position, and then patients have their own stories of how they end up in their current medical state. And it's all very complex. Everyone has their own personal stories, but underneath it, there's always this larger, systemic kind of avenues that are kind of circle or drive people into these situations. And what we are, I often have felt is kind of this sense of maybe not despair, but a sense of abandonment in a way that a lot of these people that we do see, especially in county, are exploited. They're extracted, and it's just all hosts, whether it's immigration, just economic, all these barriers are put forth onto them, and then we're left there. They're abandoned, and then we're left there in some ways abandoned to try to fix things for them. And there's actually a whole host of I guess research in this where there's actually a term called extractive abandonment, which at every level people make money from these people, but then they don't necessarily get the help that they need. And that's really kind of seeing how everything is financialized and commodified for the most part, people's physical bodies. And so there's a lot of pain there. But I think the struggle, or kind of the move, is to kind of find where this gray space where we can create opportunities to change things or to imagine how things can be different. And it's kind of I don't know, bell hooks kind of says a type of waywardness where you can imagine what might be, and you struggle for it. Yeah.
Along those lines, Dr. Truong, I really feel in my heart that we must strive for a system that is driven by humanitarian principles and nonprofit. And that just yesterday, I had a patient who was had a change of insurance and asked me I'm not going to be able to see my oncologist anymore. There's going to be a break in my continuation with them because of the change in the insurance, and they're requiring an authorization from you. And of course, I want her to continue seeing her oncologist. Of course, I want to provide this authorization, but I didn't even know what authorization I needed to submit. And she didn't even know. And she called her insurance, and they were just giving her the roundabout. And it was I had to ask multiple people in our office to finally get this form that hopefully was submitted. And now it's almost in this dark cloud or unknown box for me. Hopefully it goes through, and that doesn't feel right. And this is largely because it's driven by like insurances and policies, which is something that I didn't realize starting my path in medicine, how little actual physicians probably take role in like creating these like policies. And that's something that's been recently like more of an interest for me, because I do think that more of us who have the experience of being on the field should be involved in like creating these policies or making these types of changes. It's really difficult because our training is so hard and exhausting. So I can see why there's probably not a lot of us in like these leadership or decision making tables, but I'm hopeful that that's something that will be changing, or that is changing.
I love that. And I love that suggestion of being in policy and leadership roles, because you're exactly right. Like, you all are the ones who have that field experience, who know what the day-to-days are. You know the barriers that patients are bringing to you on a daily basis. And to not have you in those rooms where policies are being made that impact you and your patients is a huge oversight, right? An oversight of the knowledge that you all bring to the table. So within the system that we currently do have and are navigating, what do you think individual doctors like yourselves and practitioners can do in our own, and well, not our, in your own ways, to be able to make those little ripples of change, even if it isn't on a big policy level yet, but on that day to day?
I can go first, and I'll try not to talk too much because I love what Dr. Gonzalez and Dr. Truong are sharing. But I think about this a lot. Where is our sphere of influence, and how do we continue to be learners as we're going through this? Because we certainly don't have all the answers. We might have some perspective, but I think first and foremost, we're all patients and we're all family, and we're all, in this sphere, we're doctors, right? And so I think that the experiences that we have as patients ourselves or as family members, maybe also from our own cultural identity and our own community that we identify with, we have a certain perspective. But then as physicians, I think that there's a certain degree of power that we have to acknowledge that we have. And I think that if we don't acknowledge that, and we don't acknowledge the way that physicians are seen, that we sort of might be blind to some of the both opportunities and also pitfalls that exist. And so I think that there's a certain degree of like continuous learning and humility, but then there's also an acknowledgement that we do have a voice and we should be using that to really advocate. And that's why I think why we're here is whenever we have the opportunity to try to lift the voices of our patients and those we serve. I also just wanted to say quickly, like, I remember hearing a long time ago the starfish story, and it's about this child walking along the beach, and the child is picking up starfish that have washed up on the shore, and there's like thousands of them, and the child is just picking up one by one and throwing them back into the water so that they don't die. And another person comes along and says, "Child, why are you doing this? You really can't save them all." And the child just looks up and says, "I just saved that one." And so it's not a savior complex, but I think it is this notion that every single act of kindness, of care, of advocacy matters. And it matters greatly to somebody. So I think, there's obviously a lot you can do at different levels, but just acting from where you stand is really always kind of in my mind.
I think something like in my practice that I hope it's helping is that I'm also starting to do my best to bring up conversations that I can empower patients as well. Say like we're in this together. Like if they have an issue with like their insurance or even with the way like our clinic may run, I say I will try to bring it up on my own, but please know that you do have a voice and your voice matters. Can you also please, like, this is the number you can call your insurance, leave a note at the front desk, but also like empowering our patients, because I think that it's really important for all of us as patients to also know that we have a say and to be able to not create this like, interdependent relationship where like it's what the doctor says and that's it, but also instead like empowering patients and knowing that they also can help and we're in this together. That's something that has been helpful as for me, and I think also for like patients that they're like, oh, actually, I can also, voice my experiences.
Kind of paralleling what Dr. Gonzalez says. I think also it's getting, because I think it's very easy as like one provider to just be overwhelmed, and I think that part of it is to also empower your own patients to be able to advocate for themselves, because I think it's also like it feels helpless when you just like depend on one person to try to make all these changes for you. And then I also kind of change slowly, not maybe in one visit, maybe over a course of like years, but to change like the paradigm of like the relationship of like physician and patient, where I'm not here to completely make you feel well or completely healthy. And understanding like the term healthy is a very loaded term. It's very political, very like racialized. And so what is wellness up to you? And then how can you as like a patient kind of create that for yourself? And then where me as like the doctor, how can I add to that in like our little 20-minute visit? How can I just improve that to some extent? I think if you have realistic expectations and to kind of see yourself as someone that can also like advocate for yourself, I think that makes for a much better like relationship and like better outcomes.
I love that. I love the focus on empowering and advocating your patients to realize the power in their own voices and their preferences and what healthy and and being well truly looks like to them. And how do you do that though? Within, like you said, Dr. Truong, the 20 minutes that you have, how do you build relationships with your patients to make them feel like it's a safe and inviting environment where they can voice the concerns that they have?
Yeah, I think it really does boil down to establishing trust. And, we always say trust is earned. It's not like something that you just walk into having. So I think I agree that finding out the patient's priorities and what's most important to them in that visit. And then the other thing I'd highlight just in family medicine and also geriatrics is getting to know people over time, that it's not a one and done. We're not in the emergency room. We're not doing a surgery. We're actually seeing people over time and building a relationship that can grow in trust. And I think that those are some important features of being able to be a better care partner for your patient and their family, but also help, as we've talked about, empower patients to feel like they have the capability, they have the resources, and they're able to advocate for themselves as well.
And Dr. Schickedanz, how have you seen the field adapt over the years to be able to address equity and be more patient-centered?
That's a really good question. If you ask me on some days, I would say it has not adapted to do those things that we very much wish it was. But then I look at our trainees in our program, and I have a great degree of hope and faith that actually it is changing. I think we've seen over the course of decades now that medicine has become more monetized and unfortunately much more predatory in terms of the way it extracts resources from families, communities, people. And that, of course, does not uphold any principles of equity or anything that we're talking about. By the same token, there's an increasing awareness that I see, especially among the new generation of trainees that we see, who are very, very aware of the importance of health equity and justice, and often come from a lived experience of having, had hardships and having had, different diverse experiences. So I guess you could say that the system as a whole has continued to evolve to be more of a profit-driven machine, but that the individuals that I see entering the system and trying to change the system, to be change agents within the system, the individuals like those that we're speaking with right now are extremely aware and compassionate and passionate about making the system better for patients, especially marginalized patients.
Those are steps, right? Like you said, those are steps forward, and that does give you hope when you see amazing trainees who come in with that mindset of being able to change things from within the system.
And sorry, just one more thing, but I think like the struggle is kind of twofold, right? It's like one in the outer, like the larger systems, the policies, like what we can physically like offer our patients or materially offer our patients, but also I think like in kind of like a spiritual or moral sense, like what do we have to kind of reconcile with, like what do we like want to prioritize, and then how do we convince other people to also kind of jump ship on that as well.
And I think another important like reflection for me is that there's a lot that I don't know. Like I don't even know who to go to, or like what does the system like mean. It's such a big thing, like the culmination of like insurances or like different like healthcare systems. It's very challenging, but I'm definitely motivated, specifically like in this last like year, to learn more and figure out like what can I do to at least put like my grain of sand to make things like a little better. But we do not have that training in medical school, and partly because we don't have the time or like all the time like the bandwidth. But at this point where I feel like, I think George will probably agree with me, you start to feel like, hey, like we need to be involved. I don't know how it's going to happen, but something just doesn't feel right.
What are some of those suggestions that you would have? Like if you had a magic wand and you had more time, because I know you mentioned your curriculum is already so heavy, right? Your work is already so heavy. So not in this world, but in a world that we make it. And Dr. Truong, you said it earlier when you quoted, imagine what would be, right? So what would be those things that you would learn in training in medical school to help you in these situations?
Yeah, I think it would have to be very, I guess, holistic, right? In a way, it has to be like radical and understanding like the root. When we talk about social determinants of health, we like talk about like transportation, housing, environmental. It seems unnecessary or superfluous initially, but then when you actually really do like learn about medicine, like, oh, these things really do affect you, especially on a population scale. And so then like asking that question is like, what does it mean to learn it? I think in medicine to advocate for policies, everything, you really kind of have to like, and you have to be an expert at everything, but understand how it all connects, and then finding what area can you advocate for, whether it's like better environmental policies, guaranteed housing for your patients. I think we all have a place in the struggle, and finding where you can, where you fit in that best is also part of the process as well. And for me, I think I found that like teaching younger children, specifically younger like boys and men, that like there's like a better way like towards like masculinity and other things of like facet can contribute to that struggle. Even though it sounds very like arcane, obscure, it all is like we are part of this like larger mosaic, and if we can make our own piece beautiful, that the whole thing will eventually be beautiful. Yeah.
As far as your question, like what we could have learned in medical school, I don't really think it's so much more of like acquiring more knowledge, because a lot of these things are like really basic. Like you don't need to go to medical school for this. It's like reducing stress, feeling safe in your home, and having access to healthy food, being able to spend more time with your patients. So I don't think necessarily that is where like the root, some of the root causes are, like learning or more training in our medical practice. It's really like systemic resources and availability of the basics for humans to be healthy, for people to feel safe, have access to healthy food, be able to stay hydrated, and then also just like our education system, where our youth from all backgrounds have like basic knowledge and understanding of their bodies, because like the health like literacy gap is really huge, and that's a big part as well, to be able to, for in general, like our population, understand like their bodies and be able to give our bodies like what we need to be healthy.
I just want to add, I agree with what's been shared. I just want to add that there's a lot of skills in navigating the health system and navigating multiple systems, whether it's educational system or employment or finance, financial institutions, that you don't learn obviously in medical school, and you might not have learned from your family and your upbringing either, that I think are really valuable skills. And some of it's really like hard knowledge, like how do you navigate insurance, health insurance, that our patients are often looking to us for help with that. And I think as already mentioned, we don't necessarily know. We were not trained. It's always changing and evolving. And while I don't think that any of us want to be experts in health insurance, for example, it would be really nice to learn how to access the information and have collaborations and partnerships, so that we could break down silos and help our patients navigate too. I think that would be a magic wand sort of thing that I wish that we learned or that we were capacitated to be able to do as physicians. And we're really not. I often find myself, going to a website or making a phone call alongside of my patient to try to help them figure it out. And I don't have the answers, but they look to me often, or we all look to each other for those answers. And those answers are hard to find, maybe by design.
I think one just like added facet of it is, I think there's like the learning. I agree with Maria, like you don't necessarily need to learn everything, or we need to expand knowledge. But I think like the more important thing is learning how to organize, or how do we like challenge power, right? Or how do we challenge people that are looking to profit off of people that are already exploited? And what does that look like? Is that we're not educated in that, and for a good reason is to understand that also like institutions of themselves like self-propagate because they align themselves with the current like status quo. Yeah, that's right. That's kind of and so then it's like a contradiction of itself, but like we do need to like learn how to like organize with ourselves and just like realign ourselves into who are we advocating for. But
I think these are all great suggestions and things to think about. And I'm hopeful because all three of you are change agents and represent hope for our future and for the world that we're looking to create, where wellness and humanitarian values are at the center of it. And so to round this out and to end it on a good note, I would like you all to share with me, what does give you hope? What keeps you going? How do you energize yourself to keep on going and be that agent of change that you are?
I guess I'll just go first. I think one is just like I know for some reason just like meeting young people, they just like give me a lot of hope even when they come into my clinic. I think there's just like an understanding of like that life is like very hard, but then to know that like there are people that really care about the world, and that they're like, despite everything that's going on, that they're willing to like still to try to like heal themselves and to like try to also improve the world. That's like very very inspiring. And then I think the other part is just also reading, just reading all the people that have come before you, and kind of taking from like Huey Newton that we're all part of this like long process of history, and that there are a few people that like really care about the world and hold the world together, but you can be part of those people. And the fact that like you just tried and just moved the needle just a little bit, that's all that matters. And eventually we do get there, even though you won't see it.
I think it's my friendship and in the trenches. I would say that give me hope, because I do feel like I have really good friends that are very like-minded and also feel the same way. Then of course, I have a 3-year-old, and she definitely always gives me like a boost, because I do want to leave the world better for her and for future generations. And I think it's a responsibility for all of us to not lose hope and to just be kind and hopefully be able to create a better world for the ones coming after us.
Yeah, I'm incredibly hopeful. I find a lot of hope in working with the people that I work with, and I include in that those people, my patients. They give me so much hope because they have such incredible stories, and I feel like we are in partnership. And then, of course, the trainees and the faculty, the nursing staff, like everyone who chooses to come and work together every day, even when it's hard. And I'm also very hopeful. I think, as other people have mentioned, when I think of the movements that have come before us and that are unfolding alongside of us outside of medicine, for social justice and for humanitarian, efforts towards peace. And then I'm very hopeful when I think of my elders and also my own children and just the circle of life and how we each, have a part in it. And those who have come before and those who will come after, we're all part of the same thread. That gives me a lot of hope and also a lot of patience.
Okay.
I hope that the patients and everyone who sees this feel that they can reflect on their own sources of hope and their own sources of power.
I love that. Well, thank you all so much for joining me. This was such a dynamic conversation, and I'm so grateful for you all's time.